Hi everyone, my name is Dave Brown and I am a registered nurse. I am currently finishing my Doctor of Nursing Practice degree at Ashland University. I want to thank everybody for taking the time out of their busy schedules to take part in my scholarly project, which is a program that focuses on combating compassion fatigue. I've been a registered nurse for going on 18 years now, and during that time I've worked in some high acuity areas. And although not as an advanced practice provider, I have been exposed to and experienced some of the stressors of dealing with sick individuals and those that need extreme care. And so I thought a program on compassion fatigue was much needed. The reason I chose to focus on nurse practitioners is because although there is a lot of information available on compassion fatigue, much of the information that I found was either generalized, dedicated to physicians, or dedicated to registered nurses, but I did not find a lot of information that was specific to the role of the nurse practitioner. And as the role of the nurse practitioner and the responsibilities of the nurse practitioner continue to grow, I felt it's important that we continue to have research and evidence that focuses specifically on that field. So, the healthcare setting, compassion fatigue is an ongoing challenge, especially for providers facing high stress environments and the emotional demands of patients. Compassion fatigue is work related. It's a stress response experienced by healthcare providers or others that deal with exposure to the trauma and suffering of other individuals. It's often described as the cost of caring, and it can lead to physical, emotional, and psychological symptoms that impair the ability of providers to provide compassionate care. And resilience, on the other hand, is the ability to bounce back from a stressor and to adapt to challenges. Over the past several years, research shows that resilience building can lead to a reduction in compassion fatigue and stress. Mindfulness is a key component in building resilience. It promotes a sense of awareness, emotional stability, and presence. Therefore, a good foundation for this program is one that's structured around mindfulness and well-being. So this is a 4-week program, and each week there will be a specific intervention that promotes a reduction in stress, uh, mental rejuvenation, and strengthening resilience. Each week will target a unique aspect of mindful living, allowing participants to integrate small yet manageable changes that fit into their daily routine, hopefully with minimal disruption. This program is asynchronous. I know that it is a big commitment uh, just to give up any time when you have a work family life balance that needs to be maintained. So, although each intervention is supposed to be completed over a 1 week time period, how you do that in the 1 week time is up to you, essentially. Each week I will be emailing, and also there will be individual videos dedicated to each week that details the amount of time that you're expected to put in each week, but the days and how you manage that time is completely at your discretion with whatever fits your schedule. And at the time of this rollout, unfortunately, It's late January, early February, and I apologize. This program design might be a little bit difficult with the initial week, which is walking for mindfulness. So um, be careful with the weather or conditions outside with walking. Hopefully, everyone has means to do something indoors as well on a treadmill or around the office. So again, I know that's going to be difficult. Along with the weekly interventions and watching the videos that detail those interventions and the weekly emails that you'll be getting, there are a few measures that we're going to have in the program. If you haven't already, you should have received an introductory email that has a lot of what I'm saying about the program now, details, and it also includes the program consent. If you haven't received that, or if you have not checked the box and pinged that consent back to me, please do so as soon as you can. Although this program is asynchronous, it does need to be wrapped up within the 4-week time frame from starting the program. Prior to the first week's intervention, you will also receive an electronic version of a demographic survey, just briefly outlining some things about yourself, as well as the ProQual or the Professional Quality of Life Questionnaire. That instrument will be used just to gauge your current risk or perception of compassion fatigue. We will not be doing a post comparison, but this just is one means of measurement for the program. I chose to use the ProQual questionnaire because it is a validated measure and it's widely used in healthcare to assess compassion fatigue, not alone, but also burnout and compassion satisfaction. And as I said, it's just going to be a one-time upfront questionnaire at the beginning of the program. Rather, there just isn't enough time with a 4-week intervention to really get solid data to say whether or not these interventions affected your measure of compassion fatigue. Instead, at the conclusion of the program, you'll be asked to complete a brief qualitative questionnaire about your perception on the efficacy of this program and its potential future use. Hence, this is a program evaluation. So that wraps up the introductory video. You can see here the slide for weeks 1 intervention. I'm not yet going to go into that. That will be started in a separate video. And again, I'd like to thank everybody for taking the time out of their busy schedules to take part in this program. I truly hope that you enjoy it, that you find something meaningful out of it, maybe learn something new about yourself or the industry as you go on. And at the very least, I look forward to the critiques and everybody's information in the qualitative assessment at the end on the meaning of this program, what was good, what might not have been so good, and what can be done for future use. So thank you. I hope everyone enjoys.